So my name's Martin. I'm from Hepatitis Victoria, the Health Promotion Programs Manager, and we've got Nicole, who works on the HEPReady, which is the professional development workforce training part of what we do. So the presentation, that'd be wonderful. The presentation is in sort of two parts this morning, with contributions from both of us. The acknowledgement of country and the Kulin people. We pay our respects to them. And a little bit about Hepatitis Victoria. I guess most of you are familiar with us because we've been around for 25 years or more. We started off as a sort of a support agency for people who were living with hepatitis C. And I believe when Hepatitis Victoria began, we were up at the Fairfield Infectious Diseases Hospital. So we've come a long way since then. For most of those 25 years, we only got funding for Hep C, but that's been diversified a little bit now. And there's always that linkages between the different types of viral hepatitis and the importance of having those conversations about Hep B as well, because it's just as relevant to people who are impacted by hepatitis C. So we do advocacy, support, education, and I just wanted to highlight there that we've got the Hepatitis Info Line service, because one of the things that Chris mentioned is that you can do training and sort of keep educating people, but unless you've got some sort of ongoing support and contact point for them where they can sort of get any of their questions answered and things like that, the Hepatitis Info Line service is incredibly important. And it keeps us very connected to the community as well, so we get calls from people who are looking for services, people who are looking for support, and we get calls from the services and clinicians themselves. So that's a bit about us. So as you would have seen, my domain within Hepatitis Victoria is the Health Promotion Programs Manager. And traditionally what we've done is we've sort of divided up our activities according to the priority groups. That's not just about working with the groups where prevalence is highest. It's also about working with the groups where transmission risk is higher, because if you're going to be successful in eliminating viral hepatitis and hepatitis C, it's reducing those transmissions, the people passing it on to each other. So they're fairly well identified. We've got the Indigenous groups, the custodial groups, the people in prisons is a very important one group that we work with, and I think that's incredibly relevant to today's conversation, because the NSPs in prisons is something that really needs to happen. I think we're a way off getting there, but there's this huge pool of people. The rates of viral hepatitis in prisons is really alarming, and I don't think it's until they get access to clean injecting equipment that we're going to be able to address that. And just going back to the info line, I remember some time back we take calls from the prisons as well. It's a free call from them. And it was a guy ringing up. He'd been in prison for 6 months, and he said, well, for the first 3 months that I was on the inside, I was injecting every day. So it just goes to show how accessible the drugs are, and how the transmissions in the places where it's happening. Also tattooing and other things like that are going on in prisons. Drug and alcohol services and people who inject drugs, so that's the NSPs is a big part of that. And we have staff sort of who specialise in each one of these areas. And the culturally and linguistically diverse, now traditionally that's been about Hep B, but it's been really interesting because when we go out to those communities and talk to them about Hep C, it's actually something that resonates with it, and they all have their own stories about it. Very often it's medically acquired or other ways that they come across it, but it's just as relevant for them, and there's challenges with working with each of those groups. And a big part of what we do is about training, health promotion, but the training has really got to be tailored and made so it's something that the person can relate to and take away the key messages. So it's something we're very proud of, is the way that we tailor our training. Now I feel incredibly underqualified to be talking about NSP staff, considering who's in the room. But for us, they're a really important point of contact for one of our target audiences. It was really interesting to hear that data you had, Chris, about the numbers of referrals that are happening and the sort of opportunities for health promotion. because you hear the stories about people saying, well, the clientele has so many competing priorities, and how do you get those messages about Hep C treatment and testing across to that group? And the other challenge is that the different models of NSP services, and as you've said, there's the primary one where that's their business, and that's something that the EC program, which you might hear a little bit more about, but that's one that's sort of directly targeting this group. And others, it's a chemist shop where you're going in there and you're talking to someone who spends most of their day selling cosmetics and things like that. So challenges in getting to those groups, and later on you'll hear a bit from Nicole about some of the work that's been done to provide professional development to some of those groups, in the pharmacy in particular. Once again, it's customised, and that's a very important message there. The clientele of the NSPs, as I say, they've often got mental health issues, homelessness issues, all sorts of competing priorities, financial, legal things. So you've got to be able to get that message across to them. And sometimes it's opportunistic. It might just be a poster on the wall, and it sounds a bit cliche, but it's about that repeated sort of messaging, putting it across and sort of inviting the conversation to happen. We do a lot of work with the clients of NSPs, so when we do our resource development, we actually go out to some of the primary NSPs and we'll hold sessions with the clients and get their feedback on the resources that we're creating, and that's incredibly valuable for us, and sometimes we're in a position where we can lift a bit of money for their assistance. The stigma associated with this group, it's a very real consideration. And at Hepatitis Victoria, we often have a whole lot of sort of volunteers who are Masters in Public Health students. And I know very often in their course, they're asked as part of their studies to go into an NSP and experience what it's like to get to ask for the equipment, and they figure out very quickly how challenging that can be. Different responses from different sites. We don't just try to hammer home the message about testing and treatment, we mix it up with other messages, which is harm minimisation and staying safe, and you'll see some examples of that as we go through. So one of the things we do is we develop stickers which can be put on disposal containers, can be put on the pre-packaged syringe sort of bundles. Very effective, we find. And it's sort of, once again, it's just that thing of getting the message across. We refer them back to the info line, so it's, if you want to find out more. But as you can see, messages about keeping your veins healthy and happy, things like that are mixed in with the messages. Those sort of resources are really important, particularly now that you've got vending machines happening in a lot of places, and how do you get messaging across when there's no person-to-person interaction? So that's one way we do it. Now, as far as our training, a lot of it is about having those sensitive conversations, being respectful when you're engaging with the clients and things like that. We're not trying to replace the pre- and post-test discussion training that's on offer for various services through the state. So we acknowledge that. But it's privacy and confidentiality, the challenges of having those really personal conversations. And very often we will start our training with a sort of a statement saying, look, this has got to be treated respectfully, and we would like you to respect the thoughts expressed by people, because people who might never have discussed it with anyone can come along to our training and go, well, yeah, actually I'm living with Hep C and I've been diagnosed. And so it's about them feeling supported, if that's the case. And of course, the myth surrounding blood-borne viruses is very real. I've been in training sessions where there's been people there who think that, well, you start off with Hep A, that progresses to Hep B, and then it ends up in HIV. That's the thinking. So the varying levels of health literacy is something that we've got to accommodate. The key message really is that there's never been a better time to go out and access treatments. we've been very fortunate in that they didn't just list a couple of DAAs on the pharmaceutical benefit scheme and leave it at that. They've been updating it the whole way through. Yeah. And as I say, it's about reducing the transmission. It's the only way we're going to get to elimination. We do a lot of referrals to services, ones that are compassionate, because very often the default position is, I'll go and see your GP, but that doesn't cut the mustard in a lot of different cases. Disclosure, that's something that's very important and relevant. You know, a lot of people go off to the dentist and get presented with the form that says if you had hepatitis C or any bloodborne viruses, they feel compelled to fill that out and then get treated atrociously as a consequence of it. And we have some podcasts on our website which are real-life examples of people's experiences there. How do you break it to your partner that you're living with bloodborne virus or with hepatitis C? You know, they're the sort of things we ask people to consider in the training. And interpreters, you know, we will very often work with the interpreters prior to us doing that education with the culturally diverse communities to make sure that they're on message and they understand exactly what it is that we're discussing. So we know that the resources work because we get that feedback loop into the Infoline services where people cite that as where they found out about the service. You know, it's people who are using the equipment or people who come across it where it's been discarded. We just keep on reinforcing that message, you know, that now is the time. You know, it's never been easier. And as I say, it's relevant to people who are using the machines. I'm going to pass on here to my colleague, Nicole, who's going to...
I can do it.
All right.
My arm hurts, actually. Thanks, Martin.
Thank you.
So I also want to acknowledge just briefly the Wurundjeri and Boonwurrung people of the Kulin Nations and their elders past, present and future. And acknowledge that the land we're meeting on today was never ceded. I'm going to try and be quick because I don't want to be held responsible for holding up the program. But I will just quickly go through what HEPReady is. So as Stephen was discussing earlier, a couple of years ago, we really started to have these conversations about how we're going to bring people into the new treatments. So HEPReady came into being, it's a workforce training system that came about because despite the good work in the sector, there remained a significant lack of understanding about viral hepatitis, primarily among sort of the AOD workforce who weren't as health literate. Despite alarming numbers of people living with viral hepatitis, we recognised that many people in the community who are at risk of living with viral hepatitis or who were living with viral hepatitis did not actually understand the repercussions that it might have on their health and therefore weren't going forward and seeking treatment, which was putting them further at risk. So the need had been identified that we needed to train up the workforce and we had to improve the capacity to respond to clients who needed treatment, targeted treatment about viral hepatitis who were at risk in the community. So what would this new training look like? It would be face-to-face and online and or both and tailor its training needs as Martin mentioned earlier. Okay, so how do we focus on sensitive conversations? Well, we educate. We provide the information to move forward without being blinded by the myths and misconceptions, which is empowering for the workers. We practice. Case studies allow participants to look at how they might respond to different circumstances and respond appropriately. Thirdly, the lived experience is a vital component and is always a highlight of the training. Hearing an account of someone's experience of moving through the health system while living with a hepatitis diagnosis can really change the way you perceive clients in this situation. So what I really want to talk about today is the 6-month project that was funded by the Northwest Melbourne PHN to provide online training to pharmacists within this catchment. So it was free training and it was a very exciting challenge for us. So we knew that pharmacists were really at the front line and we wanted to take the opportunity by the horns and run with them. It's a mixed metaphor, sorry. But the training itself, there was sort of 2 online units, one on hepatitis B and one on hepatitis C. I should say, it was a 6-month project. The goal was to sign up 150 pharmacists into the online training and go from there. And to develop some materials. So the training itself focused on, this is a bit of a mouthful, testing, transmission, treatment, epidemiology, vaccination for Hep B, treatment targeting migrants, refugees and visa holder communities, people who inject drugs, and of course the NSP program. The online units featured video interviews with people with lived experience and had a strong focus on stigma and discrimination. I'll be really quick, sorry. We also ran a seminar on barriers and solutions in hepatitis prevention, where these issues were discussed further. So how do you talk to someone in a really busy retail environment about viral hepatitis without shaming them in front of everyone else in the room? We also had a very brief online unit for retail assistants, which had the same sort of aesthetic as these Z cards that we developed. So it was quite pretty, and it was just very much focused on you're a retail assistant, you've got someone coming into your office who's asking for a syringe pack. How do you treat them? Do you treat them differently? Do you treat everyone the same? Hopefully we drummed that home. And my final point was when we were developing the materials for the pharmacists to hand out to their clients, we knew right away that if we were going to be handing out this information to the public, it needed to be as non-threatening as possible. And ideally, we wanted to make it so appealing that when they were presented with the materials, people actually felt happy to receive it. So a lot of thought went into the design of the Z cards. And we also knew immediately, and this is my final point, that we needed to translate these materials into some other languages. So we chose Chinese and Vietnamese because they were some of our priority populations. And if you have any other questions, please come and chat to me afterwards. Thank you.